If you're traveling to certain countries in Africa, South and Central America, Southeast Asia, then you're at high risk of contracting malaria. Malaria is transmitted by the anopheles mosquito, and Plasmodium falciparum is the most common species that causes severe and fatal deaths all around the world. So if you're traveling to any of these countries, you are going to need to protect yourself against malaria. So therefore, you would need to take medication before traveling. So you have a choice of different medications such as Chloroquine, Mefloquine, Doxycycline, and atovaquone-proguanil hydrochloride. Chloroquine should be taken 1 week before travel. Mefloquine, also known as Lariam, should be taken 2 to 3 weeks before travel. Doxycycline should be taken 1 to 2 days before travel. And atovaquone, also known as Malarone, should be taken 1 to 2 days before travel. These treatments should be continued for 4 weeks after departing the area, except for Malarone, which should be stopped 1 week after you've departed. Now, the exact dose for each medication is different, which is according to whether you're an adult, child, and according to body weight. So for example, if we're looking at tablets and not liquid, for chloroquine, an adult above 45 kilos should take 310 milligrams once weekly, while a child who weighs up to 6 kilograms would take 38.75 milligrams once weekly. For doxycycline, it is not licensed to give children under the age of 12, as doxycycline can cause permanent staining of the teeth. So for children aged 12 to 17, give doxycycline 100 milligrams once a day, and for adults, you give the same dose of doxycycline 100 milligrams once a day. So let's say you have a 6-year-old child. You know that you do not give doxycycline to a 6-year-old because, as I said, it has to be a child from the age of 12 onwards. So for a 6-year-old child, you might consider, could it be Malarone, could it be Mefloquine, or could it be Chloroquine? Chloroquine is not as effective in some areas, so really you're looking at either Malarone or Mefloquine. So if you're visiting a country, let's say it's Nigeria, Ghana, or India for 3 weeks, you take Malarone once daily for 3 weeks and for at least 4 weeks after you've departed the country. What malaria medication can I take in pregnancy? Ideally, you want to avoid high-risk areas when you're pregnant, but if needs must, then chloroquine is safest in all trimesters, but chloroquine is not as effective as it used to be, especially in some areas. Then you can consider Mefloquine, which is usually used in the 2nd or 3rd trimesters, but if the benefits outweigh the risks, then you can use Mefloquine in the 1st trimester. Doxycycline and Malarone should be avoided in pregnancy unless there is absolutely no other option because of the side effects, as it affects skeletal development and it causes permanent staining of the teeth. And doxycycline especially, you usually advise to stop it by 15 weeks of gestation. What malaria medication can I take if breastfeeding? Chloroquine and Mefloquine are safe for use during breastfeeding. Malarone and doxycycline should generally be avoided, but can be used if you've got no other options, if other anti-malaria tablets are unsuitable. Whatever medication you choose to take or is most suitable for you, you should consider other preventative measures such as mosquito nets for your bedrooms, mosquito nets for your windows and doors, insecticide sprays, insect repellents containing DEET that you can apply to your skin and is safe to use in pregnancy and if breastfeeding, but remember to wash your hands. Also, wearing protective clothing such as long sleeves and trousers would help to prevent against mosquito bites. Do I need malaria medication with sickle cell? Now, sickle cell trait is a genetic condition where the individual inherits one copy of the sickle cell gene, which gives you partial protection against malaria. So you still need to take malaria preventive medication. However, with sickle cell disease, where an individual inherits 2 copies of the sickle cell gene, this does not prevent you against malaria, and you are actually at increased risk of having severe malaria. So I hope you've understood the video on what medication to take for malaria prevention. Remember, there is no one best tablet out there. It's all according to what's best for you in terms of adult, child, body weight, how frequently you want to take the medication, how soon you want to take the medication. So for example, if you're due to travel in a day's time, then it might be too late to start a medication such as Mefloquine, and you might have to consider taking either doxycycline or Malarone because you can take those medications 1 to 2 days before travel. You might be someone that's quite forgetful and you might not want to take a tablet every single day such as doxycycline, so you might consider other options such as chloroquine, which you can take once a week, but then chloroquine is not as effective as other medications in certain areas. Now I hope you enjoyed this video. Please feel free to share, like and subscribe.